Hello, Kate. Thanks for being here. So let us talk for people who are curious about what dance movement therapy looks like in real life. And my topic is DNT in Aged Care Center. So what is DNT here? Is a creative body-based therapy, and we use movement, rhythm, and the relationship to express feelings and build connection. In this setting, DNT has to be very flexible. Many people move with walkers or wheelchairs, so when we going about the sections, most of them are seated. Besides, people often have some cognitive decline, such as dementia. Sometimes they'll have a specific MSU, a memory support unit, to take care of those population. Um, and Abdi et al. Identified older people's general needs as mood support, social connections, and self-efficacy, and those triads suitable in line with DNT's role in this setting. So how do we deliver it? Most of the DNT in the HK Center are delivered in group. We fit in their daily schedule as an optional activity in the common area. About 45 minutes to 1 hour, we'll have a structured activity mainly to meet their needs. And for one-on-one, it's more like an add-on for people who don't join groups. Often they feel isolated, low in mood, or too overwhelmed. We meet in a quiet corner or at bedside. Time and content are flexible. It's a very personalized and it can be improvised to their pace. And methods for group, we can adapt chairs in circle. That means like sitting in a circle and engage in music and movement. We can do small gesture mirroring, simple play with the rhythm, and we use culture fit music. In my placement, that is Greek music. Sometimes we add props like scarf or balloon to change the movement qualities. And for one-on-one, that is spontaneous and improvised. So it's hard to generalize how individual section look like, but there's some core value that we use here. Attunement is the essential basis. We can tune in to the person's breath or tempo, or use mirroring and grounding. We might also co-create a tiny movement from what they already do, as an access to build trust or further explorations. Our objects for groups is to increase social participants and belonging, lift mood and energy, maintain safe movement and initiative. For one-to-one, reduce loneliness or low mood, build trust and regulation, and also help the person shift from passive to more active participation. What does the evidence say? And randomized trial in mild dementia by Ho et al. Found DNT reduced depression and loneliness and improved daily functioning. And a review by Jimis et al. Found DNT can improve social interaction and communication, and sometimes cognition. And there's an interesting review on DNT and falls prevention. Says program shows no evidence for prevention, but reports reduce fear of falling. That implies DNT can elevate self-efficacy. And let's look at the challenges. Mixed mobility and cognition in the group. Like some people are seated only, but some can stand. And open space means limited privacy and interruptions. And there's language barriers. For example, some residents also speak Greek. and low stamina is common. Some days we pivot to art making instead of movements, and there's a role overlap can happen. So we can have to coordinate with visual exercise or lifestyle art and crafts section. And okay, this is it extra. So a quick snapshot from my practice. We held a group session about 15 minutes. 15 people all seated in the hall. We start with greeting, then move into music driven. We explore scarves and balloons to spark play and connection. We finish with a goodbye song, say Ki Salar Salar, to bring everyone down gently. For my first one-to-one section is a social isolated resident who enjoy coloring. So in the individual section, we color side by side. I mirror small movement, share eye contact, and a smile. These tiny nonverbal moments are therapeutic materials. And below are reference. Thank you for listening.